Arthur Clarke said that technology raised to a high enough level is indistinguishable from black magic. And as I looked at my smartphone this morning, it reminded me that 10 years ago, the information that was immediately available to me at my fingertips would have taken a fair amount of time either to pull down with a dial-up modem or on a piece of paper that I had hand carried around the house. Technology has also been transforming American medicine and children's health care as well. It was only a few years ago that we had to wire by hand our stereos and speakers, but now Bluetooth connections are seamless and easy to set up. And we're using the same type of electronic communication to improve children's health care. An electronic medical record, a scale that transmits the weight of a child, a blood glucose device that communicates with a cell phone that communicates with the central computer system. All of these have the opportunity to reduce the amount of time that a child has to spend in a physician's office and improve the amount of information that healthcare providers have about a child with a chronic medical condition. Technology has also created some challenges for us. One of those challenges is, what do we do with all the genetic information that's available now? The Human Genome Project, which cost, I think, $3 billion and took nearly 21 years to complete, has provided us with an almost tsunami of information. Information that we really don't know yet how to apply. And in fact, if you go on the internet, you can have your genetics done for a few $100s or a few $1,000s, and yet we don't really know what it means. So that's an example of technology that's giving us information that we don't yet know how to apply. The internet itself is another source of information. And while my practice of medicine is relatively limited today compared to what it was 10 or 15 years ago, the patients I see frequently still bring a printout from the internet of their medical condition and a list of questions that are highly sophisticated and almost controversial because there's so many different sources of information. Indeed, the technology that we're dealing with now is a technology of information that we haven't quite figured out how to get our hands around, and information that will be very valuable in the future, and yet we haven't quite figured out how we're going to be able to use it. The other problem with technology is that technology and technology development is very expensive. And the vast amount of technology around children's health care has come from funding from the federal government and from the National Institutes of Health. Over the last 20 years, there's been an extraordinary investment in children's health and health information. We're not going to see that same level of investment over the next decades. And so we're going to have to, as a community, as a society, as children's health professionals, learn how to gain and garner and expand knowledge in a very different way than we've done in the era of expansive funding from the National Institutes of Health.